It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include... and you. Here he is, Nathan Nordstrom.
How's it going today, everybody? We have more ethics than we know what to do with, and we're so grateful for it. Today, we have kind of been looking forward today over the last 2 weeks. Every time so far, we've said, oh, well, eventually we're going to get to scope of practice. Eventually, we're going to talk about this scope of practice. And I'm excited to finally be here, and I'm excited to be here with my friend Ryan Hoyme, aka Massage Nerd. Ryan is one of the guys who I first saw on the internet showing a technique that I thought, you don't know what you're doing, do you? And it really kind of felt like that until I realized, well, he's a genius. He really does some great stuff with video and really connecting massage therapists so that they understand exactly what's going on and kind of gives them an opportunity to sit down. Now, Ryan had his own weekly show years ago, and he interviewed me several times, and this is kind of that turnabout is fair play response moment where I get to have him on my show and I get to interview him, and I'm hoping that over this year I'll be able to pick his brain a couple of times. But Ryan, how are you doing?
Frozen up in Minnesota.
Yeah, my heaters are on this side and this side, so I'm in a heater blanket right now. It's a little cold in northern Washington as well.
Yeah.
Awesome. How's work? What are you doing? How's play? All that kind of good stuff.
Doing a little bit of everything. Cardiac technician at Mayo Clinic. Working at another hospital as a massage therapist, and then running social media and shooting videos for some companies, and still have my business of shooting photos of real massage therapists too.
Oh, you mean the genius that we actually need real photos of massage therapists doing?
Yeah. Yeah, there's no long nails.
No long nails.
Yeah. That's a whole nother ethics thing too. So
low V-neck shirts that are problematic. I mean, yeah, there's a whole series of great pictures that I've seen on your site that I'm like, yep, that's an actual massage therapist who is actually showing what we do and how we do it.
Yeah.
Awesome. Well, thank you so much. If I may ask at the very beginning, websites for people to get a hold of you, or email addresses for people to connect with you with any questions they may have by the end.
MassageNerd.com is my main website, and then my business website is RyanHoyme.com, and my email address is ryan@ryanhoyme.com.
And awesome. Thank you so much for joining us today. So once again, we're going to really get into how to find out what your code of ethics is. That's one of those things that regularly kind of perplexes people. And we have the National Certification Massage and Body Workers website. Easily by going to NCBTMB.org, you'll be able to find really what the National Certification Board of Therapeutic Massage and Body Workers is. And by going through their website, you're going to find that there's a lot of other things going on their website. Today, what we're looking for, not how to become nationally certified or board certified, or how to take an exam, or how to become a continuing education provider. Today is all about ethics. And so on the bottom of the main page, it has an all about section. For some odd reason, my screen is frozen. So
you must be using a PC, right?
Hush now. Yeah, so he is the Mac guy and I'm the PC guy.
Yep.
And
we still get along.
We do. We survive it if we're going to or not. So
Yeah.
on the top, as I said, we have board certification, specialty certificates, which there are more and more that are actually coming up. We have for students, continuing education providers, how to find a board-certified therapist, how to become an approved CE provider. Oh, this is getting painful. Keep scrolling. And then on the About section, woo, we got there. We have About, Consumers, Media, Contact Us. Media is definitely a lot of things that we should be looking at eventually. But one more button should get us right down to this right here. We have Code of Ethics and Standard of Practice. You know, by the end of this year, as we get into February and March, we'll actually start looking at the standards of practice. But right now, we're looking at the Code of Ethics. And we want to see how the Code of Ethics itself really develops what a massage therapist needs to be. Because massage therapy has these standards that a lot of our state licenses looked at when they were creating their Code of Ethics for massage therapy. Or in several states, they just refer back to the National Certification Code of Ethics, or they go to like AMTA or ABMP, the professional associations, and say, according to their Code of Ethics that you need to maintain, even if you don't have board certification, they'll use that regularly. So tonight's discussion is going to be number 3. Code of Ethics, number 3, is accurately inform clients, other healthcare practitioners, and the public of the scope and limitations of their practice. So I'm going to read that one more time. Accurately inform clients, other healthcare practitioners, and the public of the scope and limitation of their practice. So this in turn is the scope of practice of a massage therapist, and making sure that you're telling people around you the appropriate information. Ryan, when's the last time you actually had to experience or address this concept?
Sometimes when I was teaching massage therapy, I mean, some students thought they could do many different kind of modalities just by watching a video and say they're certified in it. So that's the big hang up, because you want to be careful of how much knowledge you actually have and how you can back it up too.
I love the concept of watching a video. I think being able to see something really allows you to get a better understanding internally of what you're doing and why. However, the one thing that always stands out to me is that when I'm teaching a hands-on class, a technique or tactical class, I don't only talk to them about the areas of endangerment, the injury prevention, the things that you need to make sure that you're taking care of, but we also talk about the communication. And I make sure that not only I demonstrate it, but then in the hands-on portion of the class, that the student demonstrates it to me. This is that reverse respect of making sure that the instructor is not only teaching, but is confirming that the person knows what they're talking about. So the difference between certification and certificate. Any ideas there?
That's so.
Boss, let me throw you under it.
Yeah. Certificate is something institution or a CE provider gives a person for completing a specific a module or modality. I mean, this part of the class. And what was the other one again? Certification. So that's usually a little bit more lengthy. Just like with board certification, we have to take extensive long tests, keep up with continuing education every 2 years, and code of ethics, you name it. There's tons of stuff with that.
So I like the definition, because you can get a certificate of attendance for sitting in a room sleeping.
Yep.
And it's really
done that.
I think we all have, really. I mean, maybe not on purpose,
Yeah.
but I mean, yeah. So a certificate just says that you have been in attendance. A certification has a couple of main pieces. First one is a confirmation that you know the information and can demonstrate that experience. For example, the National Certification Board, to be board certified, you need to take an exam, and you need to have that exam to confirm that. The other thing for a certification is a maintenance, maintaining that certification. So for example, in 2001 is when I became nationally certified and then transitioned to board certification. And in that period of time, the amount of continuing education that I've been required to have by national certification standards has maintained me as a therapist and built me and kind of made sure that I was doing a quality job in learning and progressing. So that's the other thing about certification, is there's usually a maintenance to it, that maintenance process to secure and confirm your certification. So this is, go ahead.
And something to back up with that too is in 2005, one of my students said, "So are you nationally board certified?" And I said, "No." And she kind of looked down on me in a way too. Because aren't you keeping up with continuing education, everything else? And what I did was I had to set an example, and I signed up for it the next day then. So, I mean, and I just kept it up with, and then once the board certification, I transferred to that then. And
well, and especially people in the education realm, I see this again and again where someone has been practicing for 5 years. They have a natural gift for teaching, and so they start teaching at a school, and then someone says, "Oh, okay, well, now we're getting ready to get licensed. Should we take the board national?" And then it's that whole guilt of, well, when I was going through school, well, I just haven't gotten around. And all those things are the painful justification to say, well, am I holding to that highest standard? Am I trying to build? And that really kind of goes into part of that basic piece right there of, are you accurately informing your clients of your professionalism? Are you striving to maintain a high professionalism so you can tell your clients, yes, I am board certified, or yes, I am nationally certified. Yes, I have these qualifications to show that I really know what I'm talking about and what I'm doing. Notoriously, I'm noted for working on injury recovery, kind of more structures, integrated mobilization, that type of work. And when people say, "Nathan, how can I find another massage therapist like you?" My first answer is, well, go find a national certified massage therapist. Find a board certified massage therapist so that you can see that they have a standard and they've met that. Not that only massage therapists who are board certified are any good, but it's a way that I can confirm that the people that I'm going to be sending them to have a standard, have met that. So when I start looking at really informing people, first thing is your clients. Have you ever had a client who had assumed that you had a skill that you didn't have, Ryan?
what do you mean by that, sir?
Oh, a client who came in and said, "Oh, hey, I got my rib, it's out, and I just, could you pop that back in for me?"
Yeah. Yeah, many times. I even had a regular client come in right after he got in a car accident and didn't believe in really going to doctors and wanted me to reset the ribs and all these things. So I said, "Yeah, I need you to see a doctor first."
I love the concept of massage therapy ER.
Yeah.
it becomes a real challenge. I know several clients who have come in and told me, actually, here's the perfect example. I was in massage school. Got a phone call from my dad. I was working while I was going to massage school, and he said, "Hey, Nathan, would you come on over? I just kind of need you to work on my neck and back." Okay. My dad doesn't usually call me up and ask me to work on him, but why not? So I went over and I started working on him. I'm like, something's not right. What's going on with your neck? What's wrong with your shoulder? And he's like, I was in a car accident today. Dad? Well, so my dad is a retired chiropractor, so he knew better, but he didn't think it was really that bad. And so it was literally probably about 3 hours from the time he was in the accident to the time that I was working on him. And I was like, there's problems that could happen. And so the next day as I was talking to him, he's like, oh, yeah, I know I'm quite sore. And I'm like, that's why we have intake interviews. That's why we talk to them. And it really spurred in me at that early point in my career that it's important to do an intake interview, even if it's your dad, even if it's not a paid client, even if you're just doing a sports massage event, even if you're doing just I'm just doing chair massage, or I'm just doing a quick shoulder massage. That intake interview is important, not only for your safety, but to make sure you can inform them of what the expectations are so that they can be prepared and say, oh, okay, this is what I should expect from this massage. Having clients informed is huge.
Yeah, because especially family members and friends, I mean, they just think, oh, it's no big deal. They forget to mention those kind of things. So, I mean, one of the biggest things that scared me back in the day when I had my business, I had this person fill out a health form. So it was 2 pages long. They filled everything out. I even had a section on there about, are you pregnant? They did not check that. They were in their 3rd trimester. They didn't look pregnant at all. But they were laying prone. Wow. I was performing deeper work on them and everything else. And then halfway through, she mentioned that, yeah, I'm pregnant and this is my due date. And I mean, even though she signed it and everything else, I mean, still those kind of things come up.
I quickly had a story last week. I'll just recap it. I worked at a spa out here in Washington, in northern Idaho for a while. And I had a husband and a wife come in to the spa, and they were coming in for a relaxing setting and just enjoyance. And it was a couples massage, so myself and the lead massage therapist went and picked up this couple. And when we called them, the wife jumped up and bounced on to the other therapist, and the husband kind of creakedly rolled forward and back and got up and kind of stiffly walked over to me, and I'm like, oh, this is going to be fun. So I got him into the treatment room and asked him, so any injuries, any health history? Are you seeing your doctor for anything? No, I'm fine. I just need a massage. Okay, perfect. Got him on the table, started him face up, started working up his left leg, and noticed that he had a tube taped to the inside of his leg. And I asked him about that. He says, oh yeah, I have a catheter. I had bladder cancer. I'm like, okay, you didn't tell me about that in our little health history intake interview. And so I continued. I figured out what I was doing and kind of reassessed my treatment plan and went up to his head. And I noticed that he had a chunk of his skull that had been cut out. And I said, so what had happened there? He's like, oh, I had a brain tumor they had taken out. And so I'm like, okay, what other types of cancer have you had? And he had like 5 or 6 different types of cancer. And he said, oh yeah, Agent Orange was really bad for us in Nam. And I'm like, oh, okay. So now I have an understanding of kind of more of what's going on. And so I changed my treatment plan completely to oncology based and kind of light, energetic work, and kind of was working softer touch and all of that. And gosh, by gum, the last 5 or 10 minutes of the massage, I'm working on his left leg, and his wife, the table right next to us, says, well, I'm so glad that he can get a massage because he just recently got diagnosed with a blood clot in his left leg, and he's been put on blood thinners.
Oh.
So that he doesn't, so that he can pass it. I stopped, I took my hands off of him, I walked up to his head, and I just put my hands one on each side of his head, and just took a nice deep breath and sat there for 5 minutes.
Oh.
And the best part was, the other massage therapist in the room was sitting there, and every time something would come up, her eyes would get bigger and bigger and bigger, until I finally looked at her and realized she looked like Ryan Hoyme as the massage nerd guy. She cracked me up. And so at the end of the session, we walk out, and the other massage therapist says, I am so glad you're insured. I'm like, I don't want to use my insurance because I don't want him to die. So we did follow up with them and make sure the next day. They were staying at the hotel, and so they called and made sure he was doing fine the next day and that there wasn't any concerns. But those are those things that are really problematic in my mind when it comes down to making sure that people understand what our scope of practice is. In spas, we're known as kind of relaxation specialists, and they're avoiding the real angst of issues regarding health. So I know a lot of massage therapists who are like, oh yeah, I work on clients with diabetes and clients with all these things, but I just work in a spa, so I'm just relaxing them. And so then my next question is, so what did they ask for? And usually it's, oh, they wanted a deep tissue massage. And I'm like, wait a second, let's make sure that your scope of practice and the treatment that you're giving really connects with what that client needs and what you are giving to them. I guess I have the bigger challenge. Oh, hold on. Sorry, I just hit the wrong button. You cannot minimize this meeting. Recording is currently going. Okay, I won't do that. I hit the wrong button. There we go. Oh, I hate when I do that. So when I get clients who come in and they're like, okay, so you're a massage therapist, right? Okay, so I want you to do this and this and this and this. And I'm like, well, I can't do half of those because those aren't in the scope of practice of a massage therapist. And they say, well, my last massage therapist did those things, so why can't you? Any ideas or any thoughts there, Ryan, on why one massage therapist should do something and another massage therapist shouldn't?
I mean, the easiest way around that is just say I haven't had training in it. So that's the easiest way to get out of that kind of situation, just to be safe, even though it might not be ethical what they did and everything else. I mean, that kind of limits, and of course you want to make sure you document what you said and what they, because if it's not written, it didn't happen. So
our profession has such great ambiguity.
Yeah.
We have massage therapists who do such amazing work in different ways. And there's several times where I say, you know what, this is something that I learned from this instructor. If you want someone to do that same thing, you're going to have to find someone who does this method, this technique. And that's kind of my way in that same direction to go through and say, hey, we all have differences in our professional skill. And so being able to have the right person do the right thing is important. So awesome. So this piece goes to another group. This whole section talks about accurately informing clients, but we then also go to healthcare practitioners. Have you ever had to explain to another healthcare practitioner, Ryan, what it means to be a massage therapist and what skills, what your scope of practice is?
Yes, because no offense with doctors, but sometimes doctors will say, oh, no big deal, it's okay to massage them. I have to kind of go into depth about different kind of disabilities and diseases that people have, that even though you have the final say in it, I still need to explain to me my background and see whether it's a good fit with this client then.
Well, and situational challenges are always there. I love the concept of a person who is going through chemotherapy or just got done with chemotherapy versus someone who is 10 years post chemotherapy and is quote, cancer free. But on the health history, it says, have you ever had cancer? Or, hey, you have a person who has these different challenges and a chiropractor or a doctor refers them for massage therapy. And on the prescription, because I'm in the state of Washington, I'm very happy to be in the state of Washington because I do a lot of insurance billing here. And so in that insurance billing, one of the key pieces that we have to have is the appropriate area of the body represented on that prescription, on that note of what to work on. When you get a massage therapist referral for massage therapy and it's for carpal tunnel and the only area that they give you is the wrist and hand, that can be a real challenge because we all know impingement of nerves can come from the neck, the shoulder, the elbow, the arm. I mean, that's the entire walkway of the nerves. And so being able to talk to a doctor and present to that doctor, hey, if you're going to refer someone to me for whiplash, it would make sense that I would need the entire neck and shoulders, not just the base of the head.
Yeah.
Well, same thing with the arm and talking to doctors that way.
And what I love about working in a hospital as a massage therapist, I typically get 10 to 15 to even up to 20 minutes before I see the patient. So I can look at their chart and then I can research anything else before I actually go into the room then. So it gives me a lot more time than the average therapist because a lot of times let's say a client's coming off the street, they're scheduled for massage or following a health form, and a lot of times you don't have time to go over to really in depth, and sometimes you might not know about a certain disease or disability.
So, in other words, you're saying you don't want to feel stupid?
Yeah.
You walk into that room?
Yeah, because especially working in a hospital, I want to feel as prepared as possible because there's so many different things going on all the time compared to the average place then.
It's huge. I mean, it's such a great skill to be able to have that connection, to actually understand the information beforehand. Looking at a health history form and going in with adequate knowledge. I always refer back to going to my doctor, and when I've filled out the health history form and then told the nurse everything that I filled out on the health history form, and then the doctor comes in and I tell the doctor everything I told the nurse and filled out on the health history form, it gets taxing. And so for massage therapists who are striving to really kind of connect with their clients, their patients, it's important to not overwhelm them with asking the same information, but really try and engage with the documentation beforehand.
Yep. And then when I had my business back in the day, I would always have Ruth Werner's pathology book on hand. and especially I would ask the client, I kind of have an idea with this certain disability or disease, but can you just give me a little bit more in depth about it then? Because the thing is, they're kind of masters of their disability or disease.
Yeah, absolutely. I mean, no better way to learn about a disease than to have it.
Yep.
And the other book that I really love having as a reference material is Pharmacology for Massage Therapy. Because when someone comes in and they say, hey, I'm taking these 13 different drugs, being able to flip through and see what they're for to kind of get an idea and engage with, oh, wait a second, they didn't say anything about depression, but they're taking a antidepressant. And then being able to go in and say, so I'm noticing that this is an antidepressant. Is that something else that you're dealing with? Or I noticed that you're on anti-seizure medication. Are you having seizures? Oh, no, you're having it for this. Okay, perfect. That makes sense. But when you are going in and trying to work with someone, if you relax their central nervous system and the peripheral nervous system and they are just, that wonderful space, if they haven't been in that space for a long time, their medications can change the way that space actually feels and what it actually is like. So connecting with the patient about their condition is one piece, but if you have that wonderful opportunity to connect with doctors and connect with nurses, currently I've got a slew of nurses. I find it interesting that when you start marketing your business and you start really pushing, word of mouth always works. And so you get a nurse who comes in and they have a good experience, they're going to tell the entire floor. And they're going to say, oh, I found this massage therapist. You need to go see her or go see him. And so you start seeing that you've got 5 or 6 or 7 or 8 nurses on your schedule. And so being able to talk with the nurse and say, yeah, so here's what we're doing with these conditions. And notoriously, I've had nurses who say, oh, we had someone come in just the other day with this pathology, and gosh, it's really, really grueling. And if I know that massage therapy can help it, because one of the things that is on my annual New Year's resolution to always redo is to look up some research regarding what massage therapy can help. And it goes through, and that always helps me get back to center of research and recognizing the values there.
And the nice thing about working in a hospital too is I cannot touch a patient until I get a nurse's order for massage. And so I always talk directly to the nurse, asking them, is there any special precautions? Can they lay on their side? All these different things I constantly ask them, even before I even look at their charts too. So
absolutely. And I have to put this preemptive statement, just like I do whenever I talk about my family, whenever I do an ethical story about my family. I love my family. They're great. I love healthcare providers, and I'm so grateful that we have physical therapists, occupational therapists, chiropractors, osteopaths, medical doctors of all shapes and sizes. However, I really do always point out that everyone is a specialist. And when I go and I start talking, when I was early on, I think in my first year of practice, I used to practice in Jackson, Wyoming, in Jackson Hole. And it was very prestigious. It was a very beautiful place and a great spot to work at. And we had a doctor who came in, and he was a leading brain surgeon. And he was just really, really smart, just a nicest guy as well. And when he came in, I was completely scared. Oh my gosh, this guy knows everything. And so as we started the massage, I started working on his back or his shoulder, and he's like, oh, what's that? And I said, oh, that's your upper traps. The levator scapula is right here, and the rhomboids are right here, and here's your intercostals, and here's serratus posterior superior. And he starts laughing. And first of all, it started shocking me. I'm like, wait, why is he laughing at me? But then I realized that his next statement was, I haven't thought about those muscles in years. It's been like 40 years. I haven't messed with the kinesiology of the body forever, because he's a brain surgeon. Have any specialty or need to connect with that aspect. And so even chiropractors have their focus, and yes, a lot of times they have a lot of skill that can support us and that we can support them. But if we can connect with them and inform them of our scope of practice and remind them, hey, we're here to help. We're here to strengthen. We're here to work with the muscles and really, stabilize the human body. That then changes a huge amount of what we can show and what we can do.
Yep, and I want to totally back that up, because I live in Rochester, Minnesota, where the home of Mayo Clinic is. And here we're known, everybody's a specialist for doctors. So when you have a specific disease, you're going to get transferred to this person. Another disease and this person. So a lot of times you have a general doctor, but they're always going to refer you to somebody else. Some people get frustrated by getting shuffled around all the time, but at least you're going to somebody that's a specialist in that area that really knows that pathology then.
And we are that specialty for muscles, for massage. I do know some kinesiology specialists who make my brain hurt because they know what they're talking about, and I feel like I'm kind of in the background to them. But tactically, I hold my own. And I think that's what massage therapists need to remember, is that you can hold your own when it comes to actually feeling, touching, and recognizing muscle stability because of that repetition aspect.
Yep, and a few years ago at a conference when I saw you at, you showed me that psoas technique where the patient is prone, and I haven't gone back to the other one yet. So I still use that prone one all the time. It just makes sense now. So
it's funny how your brain is fixed on supine, 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 and then you kind of go, well, maybe sideline. Okay, well, as soon as you see something, you go, oh, let me try that. The brain just starts feeling like, oh, let's just dump everything else out. Well, that's not good, but yeah, prone psoas work is so much fun, and people just don't think about it because
people don't bite their lip anymore.
Screaming bloody murder. Yeah. Well, I still get them once in a while. However, all right. So we've gone through how to really kind of inform your client and making sure to say, hey, yeah. So as a massage therapist, here's what I can do. Here's what my focus is. It's really working with your muscles, and really kind of reminding them that we're not the doctor, we're not the physical therapist. Right. Do you have a term that you use to define out or explain the difference between a massage therapy and a physical therapist?
Yeah, what I do is I kind of say sometimes they overlap a little bit, because we do incorporate some stretching, but a lot of us are not experts in stretching, and physical therapists are more advanced at stretching, especially exercises. But we definitely know massage. We know how to manipulate the muscles. But that's the big difference, what I explain to people. Because a lot of times when I go into patient's room at the hospital too, they think, oh, he's a physical therapist, because they're not used to seeing a massage therapist at all.
True. I had one experience. So I've gotten in trouble a couple of times, not legally, just kind of in my own realm. So I was teaching a continuing education class in Ohio years ago, and so I had my curriculum, everything was good, got into the class, sat down and started kind of going through the class, and we had lunch, and I was talking about, so how many of you guys stretch your clients? And they looked at me like, what are you talking about? It's out of our scope. At that point in Ohio, they were not allowed to do stretching. Oh. And I thought, oh, I have to rewrite the rest of my class. So like post-isometric relaxation, PIR, is a deep tissue technique. It's NMT. And it's one of those things that when I'm working with a client and I'm saying, well, your physical therapist is working with you on exercise, and I'm like, okay, so let's have you actively contract this. Okay, now relax, and that muscle's going to relax and lengthen out. And they're like, well, aren't you shortening the muscle? Well, yeah, but no, not like they are. They're working with the exercise. I'm not working with the exercise. I'm working with lengthening out that muscle to get it right. And so sometimes it's hard to explain the connection, the similarities, and the differences. But it's always important to explain those.
Yep, and the nice thing is, a lot of times the physical therapists and occupational therapists will actually refer their patients to me too, because sometimes they've done everything they could for them, and they just want the patient to try something else. And sometimes they'll have them get a massage first, and then have them perform the physical therapy treatments. And
huge, right? If we can work together, we can do so much better.
Yeah.
So yeah, so I agree. That's huge. So going from making sure that the clients or patients know that we're not doctors, going to the doctors and making sure that they know that we are there for their patients is the next piece. Many years ago, I worked with a chiropractor who was just outstanding. And Dr. Guerrero was always helpful to me in kind of helping me build my practice, and always helpful in kind of presenting how to really ideas and opportunities. She once had a friend who was the lead urgent care doctor in the area that we were at. And she introduced me to this doctor, and I asked point blank, hey, how come we don't get referrals out of urgent care for massage therapy? And it really stopped him in his tracks. He was kind of like, what? I don't know. It's like, you have had a massage, right? And he's like, oh yeah. And I was like, well, massage therapy can do a lot of the things that some of your muscle relaxers, your painkillers can do without the side effects. And he's like, that's a good point. Do you want to come in and talk to all the doctors? What do you mean? He says, oh, every month we have a Monday morning breakfast and discussion about different things. And yeah, if you wanted to come in, you could talk to all the urgent care doctors. First of all, scary. As a new massage therapist going, wait, I'm going to talk to all the urgent care doctors that deal with all these massive things. And then I realized, you know what? I got to do it. So what I did, and this was just kind of the way that I kind of put things together, was I first went back to research. And I said, okay, so what are some of the things that people go into urgent care for? Back pain, for headaches, for injury and injury recovery, for sprain strain after they did exercise. And so I started looking, and I grabbed these articles, and I took the synopsis of these research pieces and put the link on it. And I printed out several pages of different subjects. So I went into these doctors, I felt very prepared. And as they said, okay, well, Mr. Nathan Nordstrom's in the back. He wants to talk to us about massage therapy and its benefit. And I stood up and I said, okay, so how many of you had a massage? And everybody who raised their hand, I said, if you haven't had a massage, would you like a massage? And everybody laughed, and they're like, well, yeah, sure. And so I gave them a half-hour gift certificate to go get a massage. And then I said, okay, so what are some of the benefits, or what are some of the concerns that you guys have when you see patients? And we went through, and they fed right into my hands. They're like, oh, we get headaches. Oh, we get back pain. I had this one patient who went and mowed his lawn, and by the time he got done with the 4 acres, he came back and his back was hurting so bad they came in and he was looking for painkillers and muscle relaxers. And I said, well, do you think massage therapy could help that? Oh, well, I'll think definitely. And I was like, okay, so here's some articles. And so I passed them out, and these doctors then felt like they had enough information that they could start referring their patients who had urgent care concerns to massage therapy if it was appropriate. I did not take away their skill to say, wait a second, I need to diagnose this and really confirm that there are these. But I gave them the opportunity to say, wait a second, there is another tool that they could use, and that's massage therapy.
Yep. And I also had to do that with the nurses where I work at the hospital. But how I did it was I talked to the nurse managers and see if I could do a little talk in front of all the nurses. And then they still weren't totally convinced. So what I did was I started going around and giving quick 5-minute massages to the nurses. And then I would talk about massage and the benefits, and if you have any kind of referrals that you can give me to give your patients massages. And I said, you look like a rock star, honestly. When you get a referral, when you give a referral for massage and they come in, they feel all relaxed and everything else. And the thing is, what I always tell the patients too, so your nurse put an order in for this massage, and it's a free complimentary massage, what we do for inpatient patients then. And they look good, I look good, they feel good. So
when the nurse comes in after, they're like, you're the one who gave me the massage.
Yeah.
Thank you. I love you.
Yeah.
Best.
Yeah.
Yeah. And it is really one of those things that if people will engage and connect and feel what massage therapy can do for them, they're going to be more happy. They're going to be more relaxed. They're going to be pushing for all those changes that are really strengthening them.
Yeah.
Um,
And what's surprising is most of the nurses, they have to go through basic courses while they're working at the hospital to learn integrative medicine techniques like aromatherapy and basic massage and everything else. But what happens is they don't have time for that. I mean, they're spending so much time charting and everything else. So that's why I come into play. So even though they do have some basic skills to perform these modalities, but I'm the one that takes care of them. So
I love that over the last couple of years, I've gone to conferences that are for Academy of Integrative Pain Management, for the Integrated Association of Alternative Medicine. And these groups that are coming together have such a diverse role and diverse practice that it really does draw together some really engaging people with people who want to do more, but really don't have the time, but want to be able to refer to the right place and to the right person. If you get an opportunity to see that there's a conference of integrated or complementary alternative medicine practitioners together, massage therapists, come on, jump on it, because it's really people wanting to talk to you. So I always suggest that.
And the problem is, too, a lot of the nurses don't want to be giving out pain medications all the time either, too, with the whole opioid problems going on in the United States. They want to try to cut down on that as much as possible. So that's why they prefer for them to try a massage first before they give the next pain pill then. So
there's a lot of painkillers out there, and there's massage. When I owned my first spa, I did a radio advertisement, and they had just gone through a cycle of radio advertisements for a bunch of medications. And that standard medication line at the very beginning, side effects may include but are not limited to blah, 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 including death. And I thought that was awkward and funny all at the same time. And so on the radio advertisement for massage, I said, at the very end, I want to put a side effects may include but are not limited to. And they started laughing. They're like, okay, give us an example. What would that be? And I'm like, patience with teenagers, smiling at your spouse, relaxation at the job, being able to work better, more effective, and sleeping better. And I just like ran off this list. And they did the ad, and I got more statements and people calling in and saying, that was funny, that was great, thank you so much, I appreciate it. Some of them scheduled, but most of them were just calling in to say, gosh, that was very fun and really engaging. Yeah. And sometimes that's what we need to do, is just kind of engage, because that's that third group that we were going to be talking about here is the public. How do we make sure that the public adequately knows the limitations to our practice as massage therapists? Have you seen any examples, Ryan, where massage therapy has been misrepresented in advertising?
Yes, for people think they're getting 60-minute massages, but they're only getting maybe 45 minutes or 50 minutes at most. Yeah,
good call. Making sure that you're stating what that hour includes, because if that hour includes getting undressed and having your intake interview and having your exit, that's not 60-minute massage, is it? Yeah. I've regularly seen massage therapists who have, not intentionally, but kind of put terms out there like, hey, we can fix your back pain, we can fix your headaches, we can fix your, and I use fix as the F word. I really don't think it is.
Mean fascia?
Yeah. Sure. It is such a challenge and negative term when we start looking at really no one, I'm sorry, doctors don't fix you. They help you so that you can have your body stabilize into that best posture, including everything to hip replacements. Yes, they're putting in something new that doesn't have the dysfunction that you already had, but you still have to recover. And so your body has to go through the fixing process of its own. And so when I get an opportunity to talk to a client, and they're like, oh, Nathan, you're the only thing that ever worked, and I feel great, and you fixed me. I'm like, wait a second. I may have helped your TMJ because I gave those muscles an opportunity to work better together. Or I may have helped your limp because I worked on your QL, your quadratus lumborum, or I worked on your piriformis. But your body is the thing that said, hey, I need to actually start doing this. How do I get this? And what can I do next?
Yeah. Yeah, because when clients say, oh, you fixed me too, I'll make the joke that I helped you just enough so you can keep coming back getting regular massages.
We call that job security.
Yeah.
Awesome. Yeah. And I do have a client that I saw last night, and she said, am I ever going to be able to not get a massage? Am I ever going to be to a point where I'm pain-free and not have to get a massage? I said, well, maybe. There's a point where you never have to put gasoline back in your car. But it stops and it dies and it doesn't work very well for the rest of the days. If you don't use it for a year, you got other problems and corrosion that build up. Same with your body. Guess what? You're going to have to work with your body and work on your body to allow it. I mean, I still attest to monthly massage will help maintain your health. And regular massage to help you with any dysfunction is going to improve your condition.
Yeah, how can we preach to patients and clients to get regular massages if we don't get them ourselves, you know?
Absolutely. I don't know how many ethics classes I've held now, where at the end I've said, okay, so how many of us are hypocrites? Because you tell your clients, what do you tell your clients about massage? Oh, you should get it once a week, once a month, once a year, whenever you're injured. When was the last time you were injured and got a massage because you knew that it would help with that muscle strain, because you knew that tension was not good for you? And massage therapist, well, yeah, but what? If anything starts with but, you're probably saying it wrong.
Yep. And what I don't get too is massage therapists say, oh, I can't afford to get a massage. So,
I can't afford not to.
Yep. And you know other massage therapists more likely. You can at least barter. So that's the huge benefit of being a massage therapist. So.
And we could talk about the ethics of barter later, but there is such a important piece to make sure that you're doing everything right.
Yeah.
But work with those therapists that really you like. If you can't find a massage therapist that you like, A, you're probably too picky, because most massage therapists are. We're massage snobs, just kind of who we are. But we should be able to see and feel the benefit of massage in any fashion. I like, so I'm still traveling quite a bit. I love going into other cities and getting a massage at the local massage clinic, because I want to see what that local environment's massage therapy is like, because they are different. They're absolutely different. And it's engaging to see, wait a second, what this person calls neuromuscular therapy versus what, I guess the perfect example is East Coast neuromuscular therapy and West Coast neuromuscular therapy aren't the same thing, just to let you know. California, Oregon, Washington, Idaho, Nevada have one idea. East Coast, when you're going New York down, all the way down to Florida, has a different idea. And yet England has a third idea of what neuromuscular therapy is. And so being able to say, what is it that we're doing and how can they help? That's going to help us understand more, especially if our client comes from one of those other environments. Then we can say, oh, you had trigger point therapy at this place. I had something like trigger point therapy when I was down in Georgia. I think this is more like what you were thinking about, being able to help them the way that they expect to be helped.
Yep. And I always knew clients and patients, one of the main questions I always ask them is, what did you not like and what did you like from other past massages? So I can really delve into their mind what I can mimic as much as possible. And even if it's some modality that I've never heard of, I'll actually have them maybe, if they know what it is, kind of practice on my arm or something a little bit. And more likely it's something that I perform already. So you can, and also with depth of pressure and everything else. And a great joke that I always make too is new patients, I always say, please let me know if it's ever too much or not enough pressure, because I've been married for 20 years and I'm used to being told what to do. So.
Wow. And I would rather have all of my clients say, oh, that's too much, that's too little, than have one sit there and just suffer through that hour and then go home going, that was the worst massage ever. We're not here trying to make you have a torturous, horrible experience. We're here to actually help you improve. And so if we can ask that really important question at the very beginning of, what was part of your best massage ever? What was part of your worst massage ever? And making sure that you can connect with those, that's great. I always wished I could read people's minds. And then I realized if I ask them the question, I don't have to read their mind.
Yep.
And I went, that's so much easier. That's so much better for us to be able to connect that way than have to hear all the thoughts that they have, which I'm probably not as interested in. So thank you guys. Let me just quickly go back to the Code of Ethics here. And we're going to quickly go over here. So once again, go on the Code of Ethics page. It's important to kind of go through and read through. We got 13 here. It's going to be really engaging as we go through the next few weeks to really remind us what these different pieces are and why. I wanted to thank Ryan. Thank you for being here with us and kind of participating with us. It was a joy to have you. Expect me to ask you to come back again.
Yep.
We always love having people who have your laugh. But we also really have a great opportunity to connect with people who want to have fun. And I know you've taken these concepts to heart. You've taught them in massage school. You've connected with people. And it's really beneficial for us to see people and kind of show the profession that knowing your code of ethics is beneficial.
And I want to compliment you too, because talking about ethics, it's really stale, honestly, but you actually make it fun. You actually make people want to learn about ethics.
Enough stories and everything can be fun.
Yep.
Yeah.
It was nice to meet you, Ryan. Thank you, Nathan. The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today. Be well and have an ethical day.